Okay, brief introduction. You don't have to look at me, you can look at my feet. This is Aunt Trish and me showing you the part 2 of the acupressure. Oh my god, Sam's dog is just the most annoying thing in the whole wide world. I'm so sorry, guys. But there are about 4 points on your legs and feet that we're going to show you, that Trish is going to show you how to induce labor. So here you go.
Okay, so you would find the point, the bony point of the ankle here, and placing your fingers just above that point, you come up, and above the third finger, there's differences. I've seen practitioners use 4 fingers up. I've seen practitioners use 3 fingers up. The whole point is that the acupressure point that we're looking for is approximately in this region. You can tell when you're receiving acupressure that the person is on the right point, because there will be a depth of sensation when the practitioner applies pressure to that point. I personally use the tip or the pad of my thumb here. If you have long nails and you're working this, then please cut your nails, because you don't want to do any damage to the person that you're actually working with, unless you become adept enough to work the tip of your thumb without using your nail. Nonetheless, these points you're going to find and you're going to hold. You're going to roll in a circular motion. Any acupressure points, any massage therapy work that a person does, always work in a circular clockwise formation. And that is quite honestly because that's the way the body works. We want to work with the energy of the body. Any one of these points, there's a number of recommendations for how to work them. Some say press and hold for up to 10 minutes. Myself, I feel as though any of this work needs to be catered towards the individual as well as by the practitioner. Everybody is different, so it's not always going to be the same. I personally like to roll in a circular motion and press in and out. Does that hurt too bad?
Just on this one, because we've been working on it.
Yeah. So I like to hold for approximately 2 minutes. There's an internal mantra that I use to reach that 2-minute mark. Everybody is different. If it's easier for you to look at a clock, then please do. Whichever, of course, works best for you. While I am doing this energy work, Hannah is visualizing and attempting to raise her oxytocin chemical process, the hormone in the body that helps induce labor. I recommend utilizing any visualization that you feel comfortable with or that pops into your head when any practitioner is working with you that will assist you in this process. Again, it's all very individual. So that's this initial point. There is a second point. Again, find the knob of the ankle, and right below it and behind it is a hollow that you'll find between your muscle tissue. And it is on that hollow that you again apply pressure and rotate, press in and out, whichever feels best. I'll apologize in advance because I do not recall exactly the names of what these points are. If I recall, this particular point is utilized also to ease or treat cramping inside a uterus or in a cervix rather, when a woman is going through her menstrual cycle. So nonetheless, these points here are all related to the sexual organs on both men and women. The third point is, yeah, we got it. So the little toe here, on the side of the toe next to the nail is this point here. And again, you're either going to apply pressure in and on and off that point. This one is a little bit more challenging to attempt any circular motion on, just simply because it is so small. And again, I hold for approximately 2 minutes. During this process, even if you are not an energy worker per se, it's important to remember that the entire point is to induce labor, as well as to induce labor to the highest benefit of everybody. I don't always believe that this works because somebody's doing the work. I believe that it works because the timing is right. We just attempt to manipulate the energy appropriately. It's not always the case, I don't think. And then of these points, we also come back, and on the inside of the ankle, again, this series of points are all related to the sexual organs. And so we're just going to stroke them all in order to hit all of those points and to activate them. Now again, I say that energy work and acupressure doesn't necessarily always work, and yet we started this this morning at, I don't remember, I think it was about 10 o'clock, and it was maybe 2-3 hours later, I think, and Hannah started having contractions, and she's continued to have them. They haven't increased, they haven't sped up, right?
Yeah, they haven't sped up in time between.
Right.
But their consistency and their pain level are the same.
Okay.
For instance, I do notice that there are not Braxton Hicks contractions. They are actual contractions. And I know the difference now just because I know the difference between a Braxton Hicks and a real contraction.
What is the difference? What's the difference that you feel?
The difference that I feel when I have a Braxton Hicks contraction, it will just feel tight and very uncomfortable. There's not normally pain associated with the Braxton Hicks contraction, and I also can walk through it. I can usually figure out a way, maybe some water, or maybe moving around, getting into a more conducive position for my back. That helps. But as far as the real contraction goes, there is no getting rid of it, walking through it. There's no drinking water that gets rid of it. And it also has a increased pain in the lower abdomen where you would get real menstrual cycle cramps. And it is like a very, very intense feeling. And they're definitely not as intense as they will be later on, or as in, you know, when you go into active labor. But I definitely do know the feeling now of when they say, oh, it feels like a menstrual cramp. It doesn't per se feel like a menstrual cramp, but it does have the sensations on the lower abdomens, on the lower part of the uterus, that a menstrual cramp creates. So I can say that much.
There we go.
Alright, so this has been a couple acupressure points. There's also a couple in your back, but we can do a different video of that later, just so that we make sure that we upload this one and it's in a timely manner. I hope that this helps somebody, and I'm so glad that my Aunt Trish is here to help me get these children out of me. Oh my gosh. Anyway, so we hope that this was very beneficial, and I'm sorry that I look like a big old rotund whale, but here's the belly.
There's the belly.
Boom. It's just huge.
Look at all.
Look at
those tiger stripes.
Yeah, I've earned my stripes.
Yes, you have.
All right. See you later, guys.